Assalamu alaikum and good afternoon, dear colleagues and friends. It's a great pleasure to be with you this afternoon. And I'd like to thank the scientific committee for agreeing to put in this session on the soft skills. The debate that you just heard a few minutes ago about patient education is a good segue to what I'm going to be talking about. So you may have the best medicine in the world, but if you're not able to communicate effectively to your patients on how to use it and why they need to use it, then it's as good as nothing. So we're going to start with ethics in medicine, and then I'll talk about the communication skills. I'm really happy that this session has come after the lunch break, which means that you don't have to use a lot of brain power. You can relax. I'll try and inspire you, maybe with some new things to think about, or maybe reinforce your practice as it's already quite good. So I don't have any disclosures for this presentation. And why are we going to be talking about ethics? And I'll give you the example of the Macchiarini scandal. Although we have a lot of ethical procedures and regulations in place, these things still happen. A lot of ethical misconduct still happen. And this happens to involve a very prestigious institution, the Karolinska Institute, which, as you all know, is associated with the Nobel Foundation. One of their board members was a charismatic thoracic surgeon by the name of Macchiarini. He was actually the first person who pioneered the tracheal transplant by using a patient's trachea that was seeded with the stem cells. He then went on to pioneer similar transplants using synthetic windpipes. But then things started going wrong. And over the course of many years, there were a lot of clinical and scientific misconduct, which were actually overlooked by the Karolinska Institute until in 2016, when this became a public scandal and they had to remove him from office. So we're going to look at ethical principles in healthcare organizations and how they can foster quality care and ensure patient safety. I'm going to talk about common ethical dilemmas and explore some strategies on how we can overcome them. So ethics is really the foundation of quality healthcare, and it is a driver for achieving the desired outcomes of good quality care. So whether we're talking about, genetic testing, we're talking about gene therapies, end-of-life care, and all that, both we and our patients are always called upon to make these ethical decisions. So to put it simply, healthcare ethics is defined as a set of principles and beliefs and values that guide us in making choices about healthcare. And then when you put it in the context of medicine, it is just a systematic analysis of helping the physician decide what is morally right. So ethical behavior is really acting in a manner that is in tandem with what society considers to be good morals. And there you will see that, we have different societies. So what might be morally right in one society may be morally wrong in another society. And that's why ethics is not law. It really goes back to what is the status of that society. But the things that, of course, constitute ethical behavior is integrity, fairness, honesty, and dignity. So ethics checks such questions that if you're asking yourself, is this legal? Is it balanced? Is it the best approach for my patient? And how will it make me feel when I've made that decision? That is an ethical question. And why is it necessary in medicine? Well, we live or we are entrusted with the lives of our patients. And if you're all fans of Spider-Man, you know that with great power comes great responsibility. And so in order to keep us in check, in order that we're not abusing this trust and power that is given to us, we need to have these ethical laws or ethical principles. So in the 21st century, it has become really a huge dilemma because of the advances in technology, because of healthcare economics. The resources are scarce, and therefore, how do we make sure that everybody is getting the right treatment at the right time? There's public awareness, patient advocate groups in the media, and then we have this transfer of decision making to the patient. And of course, you all have at some point encountered Dr. Google, and now we have ChatGPT as well, very closely intertwined with our clinical practice. Most of the patients will come into the consultation room with an encyclopedia of questions that they've already asked ChatGPT, and it's as though to put you on the spot. It's as though you're doing your oral viva once again. Is that right? Is that wrong? And what about this? And what ChatGPT said this and that. I don't know if you've encountered that, but that's what I'm seeing in clinic nowadays. And so, the surveys show that, in fact, most people will consult the internet before they actually come to us. Now, where does medical ethics really come from? It stems from this Greek philosopher and physician, Hippocrates, and I'm sure you've all heard of him because, we all take the Hippocratic oath and hopefully not the hypocritic one. And what he, had his physicians do back in the 5th century was get every physician who wanted to see patients to swear that they would prescribe regimens for the good of their patients according to their ability, and make sure that they never do any harm to anyone. The Hippocratic Oath was actually modernized in 1948, so that's, again, more than 70 years ago, and at that time it was named the Declaration of Geneva. It was then further amended in Sydney in 1968 and in Stockholm in 1994. And then it became the basis of the International Code of Medical Ethics that we know today, that outlines the duties of a physician towards their colleagues and towards the patients that they serve. Artificial intelligence, and we had a really good session in the morning on the use of artificial intelligence in healthcare. This is something that we cannot ignore anymore, is now creating a new ethical dimension as well, and I'll talk about that. So, 1847 edition of the American Medical Association Code of Medical Ethics is shown there, and you can, if you have insomnia, pick up the 2015 edition. It makes for good, interesting reading. So at the crux of the Medical Code of Ethics, there are 3 things that we need to embody: rendering service with full respect for the dignity of humanity, respecting confidential information, and then upholding honor and high principles of the medical profession. That's what we all, come into the profession with. So what constitutes an ethical issue? If you have to judge, if your decision is this right or wrong, you have to choose between 2 conflicting options. All right, should I resuscitate this patient or should I not resuscitate the patient? Whether you have to decide to do something or do nothing at all, and then when you have to weigh up the potential impact of that decision or your action, constitutes an ethical issue. And the ethical challenges in medicine are of several types. They may be related to a particular patient. So, you're worried about the treatment and the outcomes for a particular patient. Or it may be related to the wider practices that could distort our treatment decisions. COVID was a good example of that. And in medicine, it could also be related to our own personal behavior towards our colleagues, towards the hospital and medical staff, and towards the patient. So you may have a brilliant physician, good in terms of their medical knowledge, but awful to the rest of humanity. So, ethical issues in healthcare, we think usually the big issues: end of life, should I resuscitate, should I not resuscitate, human rights, prolonging life, etc., etc. But what about the day-to-day issues that, how do I behave with my colleagues, with the patients, with the other allied staff, within the setup that I'm in, whether I'm in surgery, whether I'm in medicine, and so on? How do I treat people with dignity, treat people fairly, and support my patients' choices? So fortunately, we had Bouchard in 2001. He came up with the principles of biomedical ethics that we rely upon, and you all know them as autonomy, beneficence, non-maleficence, and justice. So autonomy is the respect for the patient's ability to take their own decisions, and this is where the informed consent comes in. Patients have the right to take decisions about whether they will take the therapy that we advise them or suggest for them. Beneficence is always doing good. Non-maleficence is avoiding harm. And then justice is treating equitably and distributing the benefits fairly. So autonomy, as I've said, is to try and educate our patients so that they're able to participate in their own treatment and make their own choices. And then with beneficence, our actions must be that we do good for people, whether it is, their mental well-being, their physical well-being, and improve their quality of life. So we create a safe and supportive environment. Non-maleficence, so this happens sometimes when we're doing procedures, side effect of a procedure, you're trying to put in an ICD and you inadvertently introduce a pneumothorax. You didn't mean to do that, but that was one of the side effects. But of course, if you explain to the patients and take all the necessary steps to avoid doing that, then you've not caused harm deliberately, as opposed to medical malpractice, where the act or omission by a healthcare provider that deviates from the accepted norms or standards of practice causes injury to the patient, and this is liable to legal consequences. So justice, and this is one of the most difficult ones that we have to deal with in healthcare. Respect for people's rights, respect for the law, and making sure that we treat people fairly. But when we talk about treating people, fairly and equally, there's a big difference between equality and equity. So, equality is this situation, right? Everybody is given the same bench, but as you can see, this person is clearly disadvantaged. Equity is where you can provide for the person who's disadvantaged the ability for them also to come up to the mark. So there's a huge difference, and sometimes we don't really understand this quite clearly. So, for example, even if you're a laborer and you walk into the emergency with an acute coronary syndrome, no one's going to look at your insurance first. What they need to do first is, this is an acute coronary syndrome, save their life, and then you can think about who's going to pay for that treatment later on. So equity is what we want to be able to achieve, and not just equality. So then the other 4 ethical rules that we have is veracity, and that is the principle of the informed consent. Privacy, making sure that we, hold the information that we're given to us by the patients is kept confidential. And then fidelity, loyalty to the organizations that we work for. So what are the sort of top ethical issues in healthcare? And these relate to balancing the quality of care with efficiency. Dr. Tufail just mentioned here that I've got 40 patients that I have to see in one clinic, and sometimes that means that you're not able to give the best quality of care for each one of them. We're all pressured with time, and sometimes it's the administration. You have a 20-minute consultation where you have to do everything. You have to monitor the patient's investigations. You've got to also sit down and explain to the patient about their therapy and so on. Improving access to care, building and sustaining a health workforce for the future, addressing those beginning of life and end of life issues, allocating limited medications, donors' organs as well. When we want to have organ transplants, not everybody makes it to the donor to the transplant list. And as I mentioned, artificial intelligence with AI-enabled clinical decisions is also now becoming an important aspect of adding to the ethical dilemmas in healthcare. So let me give you an example of just 2 cases. This is a 37-year-old woman. If we can just go back, I'll just do one case. I know my time is up. So if you can just go back to the slide, sorry.
Yes, please.
Yeah. Right. So I'll just take this case. A 37-year-old woman who's involved in a car accident. She's resuscitated and intubated at the site of the accident and transferred to the hospital. She's pregnant at 24 weeks gestation, and the fetal ultrasound shows a viable fetus. Her clinical exam and EEG are consistent with brain death. The husband is also involved in the accident, and he's in a critical comatose condition. Now, the physician and the patient's family need to make a decision whether to continue mechanical ventilation or whether to stop. And this is an ethical dilemma, because here we have to engage with, this is a vulnerable patient. She's a pregnant patient who has a viable fetus. What about maternal and fetal rights? Who is the person that is to make that decision? Is it the family? Is it the physician? And what about the conflicts of interest? So I'm going to skip the second case because we don't really have time, but really emphasize on how AI is also going to give us ethical dilemmas. And we need to be thinking about this. The 4 principles that we talked about earlier are equally important, but we need to remember that the AI technologies that are presented to us should be that they complement rather than replace the clinician's knowledge. If you're going to use an AI-enabled clinical decision tool, then the clinicians are responsible, for the decisions that they take, regardless of what the AI system advises. We need to also be able to empower our patients and educate the patients that we are using these AI decision tools, and the developers of these tools should also be accountable for the applications that they introduce into our healthcare services. So my time really is up. That's all I have to say about ethics, and I guess we can move on to the second presentation.